morning. Welcome to Queening with the Empress. We continue our conversation of the effects of COVID-19 pandemic on our mental health. This is part 2. Remember, you watched part 1 during the conversation. I ended up having to take time off my phone. Like, I only go on my phone and I only respond to people that I know what they're about. Emagrupini ngamanzi, because emagrupini abantu bayathumeza izinto ezingamanga, izinto eziliqiniso, izinto ezinjani njani, and people don't care. Even videos, people forward videos. Umanesi just mentioned in the comment box that there's a video, I think a few days ago, of a woman who is said to have been beating up a child. I didn't watch it. It was shared in about 4 or 5 groups I'm in. I didn't watch it. I didn't even download it because mina ngokwami, I know how it would leave me feeling. So I did not watch it. But ngithe ngithi ngiyathi ku Facebook ngafica ikhona ngahle ngamute lo muntu oyishayileyo. But you know, there's so much. Do we take responsibility of the things that we share? Do we consider what it does? If you have the strength to watch 3 minutes of somebody else doing something, or video, accident, or being the one that has the guts to forward a death notice without any care, do you ever think about how it impacts the people that you're putting it out to? So now that Zenani is back on, I think I was just asking you, how do we safeguard? I think maybe that's what I should say. How do we safeguard our mental health in a time of 24-hour news cycles, in a time of social media, in a time of everyone wanting to be the first to break the news, in a time of a pandemic?
Step away. Put that phone away. Have time. To look for my messages only, and I'm going. You know what? It's understandable that under lockdown, everyone wants to go and do gardening, do chores, journal, do gratitude lists. There's so much that you can do to try and cope through this lockdown. Do phone calls, do text messages. There's so much. And I always say, you know what? You know your triggers as a human being. You know yourself far better than the next person. Learn your triggers. Find out what triggers me to have anxiety. Can I step away from those triggers? Can I protect myself from those triggers? And with social media, yes, you can. You can put your phone aside and tell yourself that I should have boundaries, even with technology. I should be able to say, from this time to that time, I'm not touching my phone. From this time to that time, I'm not going to be on that particular social media because I've noticed it triggers me. So protect yourself. Learn your triggers. Identify what works for you to make you feel better. So that's the best advice I can actually share with everyone. Learn your triggers, identify them, and protect yourself from things that trigger your mental health. So yes.
Oh, thank you so much. I love that step away. Step away. Why are we in denial as a people about mental health?
Conversations around it. We don't have enough information about it. When people talk mental health, they think we're talking mental illnesses. Mental health is equal to physical health. That means you're just talking about the health of your emotions, the health of your thinking pattern, your behavior, the way you're feeling. So just empower yourself. As much as we empower ourselves about cancer, we empower ourselves about different types of diseases. Empower yourself about what mental health is. What can I do to get myself mentally fit, like we keep ourselves physically fit? So let's empower ourselves as to be able to make it an important conversation, not just in public, but even in private, within yourself and with your family members.
I think just before we've got a few questions to go through, I would love to find out, where can people get assistance? We've spoken about it, and where can people get assistance if they ever feel like they are going under, if ever they feel like their sun is not coming up and they're stuck in darkness, if ever they feel overwhelmed and they just need someone to reassure them? Are there places they can go to get the assistance?
There are so many places. I probably won't be able to list them all now. We have Contact Shangri-La, they offer free counseling sessions. We have Musasa, they also offer counseling for women. We have in Harare, the Friendship Bench that offers free counseling on phone as well. There are so many different types of organizations that are offering, and there are also some counselors who are offering free counseling, and of course paid sessions that you can also access. What we also do as Afrex is we refer you based on what you have shared with us to say, okay, I'm feeling A, B, C, and D, and then we tell you, okay, so the best people we think can address what you're feeling is this organization or that organization. But if you are in a community or an environment where you don't know of any organization or you don't know of anyone who offers counseling, go to your local government hospitals. They offer counseling as well. Go to your GP. They are supposed to give you some counseling as much as they're supposed to prescribe something for you. So connect with organizations such as that. There's Christian Counseling Center as well. They offer counseling as well. So many organizations. So reach out to organizations that offer this type of counseling sessions. Reach out to us and we refer you, and don't be shy. Don't be shy. Yes, it's true. I saw one question on the group. Someone was like, it wasn't a question per se, but an opinion to say that people are afraid to speak up about having a mental disorder or an illness, or they're just mentally like having challenges, and they're afraid to talk about it. You cannot be afraid of talking about something that is affecting your daily life. Protect yourself. Protecting yourself means you have to fight for yourself. Ilwa, guys, let's fight. Keep yourself fit. You only have one life. Don't allow your mental state to be reduced or to be severe simply because you're afraid to reach out to someone.
Okay. Alet says COVID-19 is really taking a toll in our mental health. Imagine you're supposed to write your part 2 exams and you really can't because you are under lockdown. Worse, you are supposed to go for attachment after the exams and the companies do not take attachees because it's lockdown. This is really depressing. And Pronella is saying the problem with our society even today is that we still think mental health is not a necessity. If someone gets it, they tell you, nah. Mental illness are for white people, especially things to do with bipolar and the like. So these are some of the comments that we are getting. And it goes back to what we were talking about, that we are in denial because we think it happens to a certain type of people and it does not happen to us. And Carmen is talking about also the issue of the stigma, which I think you raised, Zenani, when you were introducing yourself, that there's a lot of stigma and we need to get over it, to finally just get over it and address the issue as it is. Umanes is asking a question and she's saying, what is bipolar, or how do we identify bipolar in somebody? I think that's addressed at you, Zenani, not at me.
Yes, so I always say to people, try and avoid being a diagnoser, meaning try to avoid not to go around looking for symptoms and trying to look for ways to identify if someone's got this disease or that disease. To be honest, a professional is the best person who can actually tell people, yes, you have a problem. But with bipolar, it usually affects the person's emotions. It affects how they are thinking. 1 minute they want to be productive, but they're so depressed. It's like they're being fought within themselves. There's no balance of, today I want to be productive, I want to do well, and then your emotions are feeling the total opposite of how you're feeling. So it's like drastic mood changes within yourself. So but what I always share with people is that the only way you can identify if someone is not mentally well is the behavioral change and how they're acting. Are they hurting other people in their actions? Are they harming themselves in their actions? Who they are becoming, affecting how they are even working or how they're living on their own, right? And then if you find that this is a severe thing that's happening with them, then look for ways to let or to link them to professionals or to take them to where help is. Otherwise, this whole thing of going around diagnosing is not a good idea. I cannot endorse it either. Only a mental health professional can be able to tell you that, yes, you do have a bipolar, yes, you do have schizophrenia. They're the only ones who can properly diagnose you.
Okay, Carmen raises a very great point about, and I think I've experienced it, where women, it seems easier for women to seek help than for men. Because I guess it goes back to culture where men are strong and they can take everything on their shoulders, and men cannot have a weak moment and men cannot ask for help. And that in itself, I think, especially over these lockdowns, we've seen the effect of all that being boiling over at some point and erupting, unfortunately, at the wrong people. Is it something that you have experienced, that we have more women seeking help than men?
Funny enough, as AFREBS, the organization I work for, the guys do come forward. There's a balance. Somehow there's a balance. I actually did attend a talk with City Council, and City Council was sharing that we have more women coming in and getting attention, and men only come when it's severe. And unfortunately, that's a behavior that is affecting them because they're not getting help on time. So yes, I do agree that men have that problem of not seeking help on time. But from my experience, I cannot say that men don't seek for help as much. I encountered so many guys who come forward who say they're struggling with anger problems, they're struggling with handling their relationships with different people. Some are depressed because of the lack of love they have had with their family or their fathers. A lot of, when we used to have our support groups when we used to have our on-ground support groups, we had more guys than girls, funny enough. More men were coming in more than the guys. More men were inquiring than the ladies. So for me, that's something that needs to be investigated on. What is it really? Is it more men or more women who find out to look for help when it comes to mental issues? It's something that I think there's more investigation that is needed. But in terms of us having more people coming in and asking for help, it's more balanced. I have not really noticed if we have more women than men, but when it comes to support groups and for referrals, it's mostly the guys.
Oh wow, that's very nice. I'm glad to hear that. There's the issue Memorinkwe is talking about. Do we have enough centers to deal with people with mental health, as we have seen some in the streets, and what can be done to reduce these cases?
I think we do have services that are available. Like, I say to people, with counseling, talk therapy is great, yes. We do definitely need more organizations to open up, more centers to open up, because there are remote areas that is necessary. We do need government to even fund that area. We only imagine South, North, here in Gweru and Bulawayo, we rely on Enguchesh, as even in Ghana, you find there is a hospital that can contain people with mental illnesses, but severe continuous versus cases.
Sandra Svanda has her hand up. Sandra, come through.
For program, we really need to be there for each other and help each other. These are challenging and times that we are going through. My question, I was just as someone from a Christian background, I was just trying to think, how do I balance the getting help from the organizations, from doctors, and different other help as compared also to getting a spiritual help. When I say spiritual help, I'm saying where the Bible comes in to counsel, to, because as a Christian we are told that the Bible has everything, or Jesus is there to help us. I'm giving an example. I know people have different beliefs. I'm just giving an example, a general example. So then my question is, how then do I know the boundaries or of allowing Christianity to come in when I have mental needs, and also allowing these organizations? How do I balance? How do I strike the balance? Or how do I, yes.
Okay, Sandra, if I heard you right, you're asking how to strike a perfect balance between your Christianity and your mental health, seeking help. And okay, so I do not have, please do not quote me, I'm not a professional, and unfortunately, Zenani is trying to reconnect, I'm sure, but I would say to you personally, your mental health is important, and you would know where you stand because you would seek the help. I don't think the two should ever have to, if you're seeking medication or assistance, is it therapy, I don't think it should ever be in collision with your faith. So that could not be that could be like a wrong answer, I don't know. But I am not a professional. I would love for someone to assist, maybe in the comment section, or for those that are watching, if you have a response, please kindly assist with a response for Sandra. Pronella, you've got a question. I'll take one more question and then we will round it up. Go on, Pronella.
Yes, hi, can you hear me?
Clearly.
Okay, thank you so much. I don't know if I can be able to answer the question that Sandra is asking, but I am willing to try. So having to strike a balance between Christianity and how you can seek help, maybe from the medical fraternity with regards to mental issues. Firstly, I believe like the Christian sector, maybe we say even our churches, they do have esingathi counseling wards or something like that, whereby they take people whom they see to know this person seems to be suffering from this kind of condition. So like balama counselors, they take you in there, they counsel you like spiritually to see maybe if you are able to benefit from all those kind of counseling things that they would maybe be offering you with regards to maybe your mental health and stuff like that. At the same time, I believe that whatsoever is being taught or being maybe offered in that counseling session does not contradict with the counseling part that you tend to get from the medical fraternity. So I believe ukuthi ama churches, Tina as Zimbabwe, we are a Christian nation, if I should say. So I believe within our Christian churches and stuff like that, ama counseling sessions that we have do not contradict with the medical fraternity and stuff like that. So those churches that we go to every Sunday or maybe every Saturday, they do offer counseling sessions for people with mental health, maybe for people with emotional, like who are maybe emotionally abused and stuff like that. So I believe we are able to get help from both those two sectors at the same time. I don't know if I managed to answer the
Thank
question.
you. That was, oh, thank you so much. That was very enlightening. Thank you so much, Pranella, for that advice. Okay, so as we round up, I think we have covered a lot, and we realize that this is definitely a conversation that we need to have in our spaces, a conversation we need to have with our families, with our friends, with people that we work with, and address it and call it out for what it is exactly. Not to call it out as something else, but to say, this is what it is. So I would ask Zenani, who's just come back on, to give us her parting shots. Zenani, could you give us your parting shots? And I would ask that you also put your information for AFRIBS on the chat so that people can have access to you and continue the conversation with you. So, okay, I will close and say, for my royal thoughts today, mental health awareness is very important for me, and I hope you also, as you listen in, you take it very seriously. Look out for those around you, your family, your friends, yourself. You know, try and detach, switch off. Amafoni eteswatandayo, our gadgets, the news, things like that. Try and take time out. Do something different. I plant. Because of that keeps me away, but it also gives me some form of peace. But also to us, we need to take the responsibility of when we are sending messages. Before you forward, before you say this, before you do that, make sure that one, it is verified information and you're not sending information that is a lie. Also, cabanga ukuthi into oyithumezayo, how will it be received by other people? So don't be the one that wants to constantly break the news. Don't be the one that constantly wants to be there. At times, sit it out and leave it. And to everyone who's going through something, like we're all going through something, I can only say I wish you a lot of love, light, and support. Please do not be afraid to seek help. Do not be afraid to ask for help. Do not be afraid to say, today is a tough day. And when you're going through a tough day and all you can do for that day is just to make it, just make it the best way you can. We care about you. And I know that with mental health, at times we feel like the world would be a better place if we are not in it. It would not. You are loved, you are seen, you are needed. So everybody take care of yourselves, stay safe, stay healthy, stay mentally healthy, and take care of your loved ones. That really is it from me today. And remember to sanitize, to wear your masks, to socially distance, to stay at home, to stay healthy. And don't forget to subscribe to SiteZW social media pages right across so that you're always on the pulse with what's going on. So from me and my wonderful audience, I would love to say bye.
Imimika nguruma ofu amunokudzidza unoswera muchienda kuJoburg muchiita zvekuita umbavha ngadaro unonzwa sei
Nyakuchaya so.
I would love to hear, what is your thought of consent? What do you understand?
Consent is when I can actually say, yes, I can agree that we can do this together. That is what consent is, and that is what it means.
It's a good morning to you. Welcome to Asake Online. My name is Zenze Ndebele, and this is the Breakfast Club.
Hayi chance anzaye ngithole cause mina ngifike stage abafaka bangalasa mangithreatena lo ngindodo wabiyale esithi sebenza icase yami womfotho wantshela ukuthi mina mangingavuma ngiqale ukuthi ngine ngayenza konke ukubulala amahundu lana ngizophiwa injection so mina injection ngingakwazi injection.
Hello and welcome to Asake Online. My name is Leslie Moyo and the name of the program is Fix My City.
And today sikhuluma ngoba sikhangela iphayili yezibi lesibona izodantshwa lapha phezulu, and we are worried as residents apha nalapha eLuvuvu ukuthi kade kuhamba njani ku city council. Undandori thulo. Kanti wangathatha into ozigwanisayo kanti.
Very sad to see that citizens had to take matters into their own hands in this way to try and obtain some relief for their starvation, because everything is being heaped on them. The 2% tax heaped on them, the price of fuel rise heaped on them with extra combi costs.